This presentation will be discussing abortion as a social issue in the social world. Throughout this presentation, there will be psychological applications from social thinking and social influence, analyzing relevant social factors. The concept of reciprocal determinism in the interpretation of social psychological theory will be addressed in relation to this social issue. The identification of a specific career or discipline will be acknowledged that would be well suited to addressing the underlying issue of abortion. Before getting started, let's discuss what an abortion is. An abortion is considered a procedure completed by a licensed professional medically or surgically removing the placenta and embryo or fetus from the uterus, resulting in the termination of the pregnancy. Medical and surgical abortions are the two categories of methods utilized. The abortion pill is the only form of medical abortion available. There are 5 different surgical procedures that can be completed. They are listed in the presentation, but vacuum aspiration, dilation and evacuation, and induction abortion are some examples. Now that we have established what an abortion is, let's discuss the history of abortions in the United States. The social issue of abortion has been a debate for many decades, and not just in America. The procedures of abortions have been completed ever since women have given birth. Abortions date back to the biblical era. Right before the 1900s, they became illegal. Believe it or not, they were not always considered controversial. In 1973, Roe v. Wade was a court ruling established to protect a woman's rights choosing to have an abortion. We have discussed a brief history of abortions in the United States. Now let's talk about if there's an age limit in consenting to having an abortion. There is not an age requirement to follow through with an abortion. However, consent for someone under 18 varies state to state. The states are listed where parent consent is not needed. A couple of them include Alaska, New York, and Vermont. States where at least one parent or guardian gives permission to follow through an abortion include Alabama, Florida, Georgia, and New Hampshire. These are just a few examples. In the states where at least one parent or guardian has to give permission, a judge has the right to excuse the parent permission needed. We have established that any woman can follow through with an abortion. Now let's consider what factors contribute to an abortion. Some factors that contribute to an abortion are chromosomal defects of the fetus, previous history of receiving abortions, and the maternal age at the time of pregnancy. The fetus may not be growing properly and have some defects leading to the need of an abortion. A woman's uterus may not be physically capable to nurture the growth of a fetus. Having multiple abortions can cause physical and psychological effects on a woman, making it harder to carry a baby full term. A woman's age, personally, depicts the yarn to be a mother, right timing, and physical health. Factors were considered that contribute to an abortion. Now let's discuss some reasonings women may consider getting one. Women may consider getting an abortion because they are financially unstable to support the needs of a child. The detrimental incident of a rape crime could be the nature of how the child was produced. The mentality and physical health of a woman at the time of pregnancy may be unstable to care for a child alone. Abortion is relied upon as a contraceptive for some couples due to poor communication, lacking effective methods of contraceptive, and poor planning. This is found by Moore, Singh, and Banco, 2011. Due to the inappropriate timing of pregnancy, there are conflicts with personal, educational, and career goals. The reasonings to obtain an abortion varies woman to woman, which can lead to psychological issues post-abortion. A woman can experience increased emotional issues added to pre-existing conditions. The feeling of abandonment and perception perceived by outsiders can enhance psychological disorders. Rates of low self-esteem will increase. The presence of psychological disorders such as bipolar and depression appear in women who choose to abort. This is found by Bellini and Buonocore, 2013. Psychological issues are experienced when a woman is dealing with trauma that is unresolved prior to pregnancy, during, and after abortion is completed. Discussing some psychological issues that are experienced by women after having an abortion are significant. Let's apply psychological insight on abortions and how it is relevant. First, let's view social influence. Social influence refers to the actions or presence of others altering another individual's behavior, attitudes, and beliefs. The influence of politics and their views on abortion factor into decisions made by women considering going through or not going through with an abortion. Family members or friends closely respected by a woman influence their perspectives of abortion during discussions. This is found by Kinney, 1993. The psychological insight of social thinking also reflects relevance to abortions. Social thinking refers to making sense of intentions, feelings, and thoughts between self and others from a distance, coexisting, or interacting actively. It is hard to change a person's beliefs or attitudes. It is possible to instill doubt and persuade them on changing their perspective, but does not mean they will. Pro-life and pro-choice groups come into light under social thinking based on facts. Both thought processes of those against and for abortion are considered. The interpretation of reciprocal determinism is relevant to this social issue. The Self System in Reciprocal Determinism was written by Albert Bandura. The purpose of this theory is to examine an individual's behavior, which is influenced and influences their own environment socially and through personal factors. An individual has the capability to control or determine the behavior by events or social stimulus, through processes cognitively and the surrounding environment view through the reciprocal determinism concept. This is found by Bandura, 1978. Behavior consequences can shape an individual's behavior after getting an abortion that is displayed in the community in a negative way. Research methods are described to investigate relevant phenomena. In the article Endorsement of Abortion, the Differential Impact of Social Perspective on Women and Men, the authors explored the endorsement of abortion between men and women through perspectives socially taken influence differently. The authors utilized 145 students of both men and women in a university setting with a random condition assigned, judging between themselves and another being. The authors utilized a questionnaire for participants questioning situations that may influence a woman's consideration to obtain an abortion. Decisions regarding reproduction by women is impacted by the input of the partner. This is found by Couture et al., 2016. It was found that both men and women endorsed the decision of abortion more for others than themselves. The theory of planned behavior interprets the social psychological theory in relation to abortion as a social issue. Isaac Agen developed this theory in 1985. The prediction of behavior makes the planned behavior theory social psychological framework popular. Actions of individual phenomena reflect personal values and motives and goals, viewed as social action phenomena. This is found by Snyder and Amato, 2007. There are three considerations guiding human social behavior. First, beliefs on behavior outcomes, negative and positive, are considered. Second, normative beliefs give the normal expectations of others. Lastly, control beliefs hinder behavior performance when considering factors present. Choosing to follow through with an abortion or not is a process that takes a lot of considerations. Having unprotected sex comes with negative and positive outcomes. Examining the history of abortions, understanding what it is, and how social psychological insight is relevant to the social issue leads us to examining the social psychological outlook. Patients deal with psychological results following the abortion procedure. Abortion is viewed as a stressful encounter. The response of the encounter varies woman to woman, considering individual styles of coping and the value of the pregnancy. Healthcare professionals experience psychological effects as the one completing the procedure. A social psychologist's career is well suited to addressing the social issue of abortion. A social psychologist examines how an individual is influenced by social settings and environments and by interactions with other people. They also examine how an individual has influence on their social settings, environments, and their interactions with others. A woman's decision to follow through or not with an abortion is influenced by others in their surrounding social environments from the society at large, with the religious, legal, and cultural aspects. The work of a social psychologist could establish programs informing patients on the potential dangers of abortions. Abortion has been a social issue for many eras. There are psychological effects associated with abortion. Choosing to follow through with an abortion or not is a process that takes a lot of considerations. It is hard to change a person's beliefs or attitudes. It is possible to instill doubt and persuade them on changing their perspective, but does not mean they will. An individual's behaviors are influenced by their personal and social factors and their surrounding environment.